Welcome to the Pottstown Area Health and Wellness Foundation's webisode series on the opioid crisis. I'm your host, Beth Trapani, and in this webisode, we're talking about Real Response Matters, the treatment plan and treatment options for people who are addicted to opioids. And I'm joined by my guest, Ray Leap, and Ray is a nursing care manager for community health and dental care, and Danielle McLaughlin, a case manager supervisor for creative health. So thanks for joining us. You know, 1 in 4 people who get long-term opioid treatment end up with an addiction, and it happens very, very quickly. Tell us about the pathways that you see people taking who end up in your care for opioid addiction.
Some patients come in addicted from experimentation, getting it off the street, taking it from a friend, taking it from a family member, and their addiction starts that way. Some patients actually have legitimate prescriptions with legitimate physiological reasons for taking it and end up addicted to the medication. It just depends on the person's chemistry. Everyone's different. Some people, it happens very quickly. Other people, it may take longer. I see various starts to their opioid addiction.
If a doctor prescribes an opioid for you, say you're on it for a week, you're recovering from a surgery, can it happen that quickly?
It can.
Okay, so it's something to really be concerned about. If you find yourself feeling like you need more, what should someone do?
Talk to their clinician, talk to their prescriber. There should be a plan when it's given to you. That's how I feel. At this point in the opioid crisis, there should be a plan. How long will I need to be on this? When should I start tapering it? When should I start being concerned that it's too much? But I don't think that conversation happens on a regular basis.
What should someone do if they don't have health insurance? How can they access services?
Well, they can come to community health and dental care. If they call our Center of Excellence line, that is a state-awarded position that we actually take phone calls for anyone who needs help with opioid addiction. If they don't have insurance, we have a sliding scale where they can get care at a very reasonable price. We will help them apply for Medicaid if they qualify. We will help them try to find services in the area so that they can get help.
How treatable is this? Is it something that, you know, is tough? Is it insipid? Is it something that people can move past? What's the recovery like?
It can be hard. It depends on how many years of use. Some people are really ready. Some people aren't so ready. They know they should be ready, but they just aren't. There's medication out there that does help, and that's why I'm the medication-assisted treatment nurse. That's what I manage, those patients. There is medicine out there that can help you, though. They're terrified of withdrawal, and that's their biggest fear. So we have medication now that can help with that.
The treatment program, is it outpatient? Is it in-service? What can someone expect?
Well, our treatment at Community Health and Dental is definitely outpatient. But if they...
Right. At Creative Health, we're able to assess for outpatient services, inpatient services, and refer if MAT is appropriate for them.
And by MAT, you mean?
The medicated assisted treatment.
Okay, for a more involved type of treatment. What's the solution? Where do we go? How do we start addressing a solution to this issue?
I think the warm handoff in the emergency room was a start.
It was. So recently we embedded a program in the hospital, in Pottstown Hospital, the Warm Handoff Project. So we have a care manager that's actually placed in there, and she's able to engage immediately with somebody that comes in from an overdose and approach them and talk to them, give them resources about both facilities, both agencies, and possibly do an assessment and get them directly into treatment.
Okay. How do you know if someone has an opioid problem?
There's multiple ways. Emergency room visit, obviously, for an overdose is one. There's also family members call for them. Family members will see the problem before the patient recognizes it sometimes. They will call for help. We get phone calls from probation, from jails, from rehabs. So they're child and youth services. So there's lots of referral sources that come to us because they recognize it sometimes before the patient does.
What should you do if you have a family member who you think might have an addiction?
Call the Center of Excellence. We will reach out to them. We try to get them to call the actual patient to call us, but if a family member calls, I'll ask them to put them on the phone. Are they willing to get help? If they're willing to get help, we can offer it to them.
Great. And there's hope. You've seen success.
Yes.
Yeah. So if you or someone you know is addicted to opioids, or if you even suspect that there might be an issue, we ask that you refer to the resources on our screen. We have links and phone numbers. And also for more information and more webisodes, please visit pottstownfoundation.org.